Welcome to this episode where we're going to discuss some of the findings from the Task Force on Genetics at the 6th World Symposium on Pulmonary Hypertension. So today we're going to talk a little bit about genetic mutations. Are they thought to be the underlying pathophysiology of PH? And what mutations are thought to be of principal importance? Well, here's a very complicated slide that really highlights the fact that there are so many different processes that occur in pulmonary hypertension. Everyone is well aware of the BMPR2 receptor mutation, which is thought to contribute to probably 70 to 80% of the heritable PAH cases. But there are many other mechanisms as well. ELK1 can also be associated with Osler-Weber-Wandu syndrome, and K3 mutation was described at the last World Symposium. Everyone knows the very integral involvement of the SMAD system in the development of pulmonary hypertension. One new mutation that was discussed quite extensively this year was the EIF2AK4 mutation, which has been identified to be associated with pulmonary veno-occlusive disease. And frankly, there are probably many other mutations that we haven't identified. We've all seen patients who have a very strong family history in whom we cannot identify a gene. So there are probably more that are going to be found by the time we do another World Symposium. We certainly know that patients who carry the BMPR2 mutation have worse outcomes than patients who do not. This slide compares the total population of BMPR2 receptor mutations and the solid line on the bottom and their outcome versus patients who don't have that mutation in a French population. And if you look at the patients who present younger in the right panel, those patients who are less than 50 at the time of diagnosis, you can see the separation of the survival curves is even more pronounced. So the younger patients with this mutation have a particularly poor survival. These are some new data on the EIF2AK4 mutation, which is central to pulmonary veno-occlusive disease. This is a family that has been identified again by the French group that has pulmonary veno-occlusive disease. And they found biallelic mutations in 25% of the 20 sporadic patients with PVOD or PCH as well, which really, I think, has led to some changes in practice. When we clinically suspect pulmonary veno-occlusive disease or PCH now, we do this genetic marker, and if it's positive, then we feel that that diagnosis is quite likely. Again, the earlier disease onset portends a poor response to therapy and higher rates of transplantation in patients who carry this particular mutation. 94 patients in this sample, which is a very large sample size for patients with PVOD, 28% of them carried the mutation. And you can see from the slide that the patients who did carry that mutation had poor outcomes, death or lung transplantation, versus patients who did not. This is very important genetic mutation information that was shared at the World Symposium, something that could particularly be helpful in identifying pulmonary veno-occlusive disease patients. Thank you for watching this episode of MedEd on the Go.